I wanted to share with you the story of a pleasant patient of mine, Rebecca. She's a 41-year-old African-American lady who happened to be diagnosed with a very advanced stage 4 breast cancer. And she religiously went through conventional treatments that were offered to her back in 2011, including chemotherapies very aggressively, and radiation as well as surgery. Further, she progressed, although she was receiving hormonal blockade and was following up with her oncologist, both in US and in Nigeria, where she's from. And further, because of failure of such therapies, she referred to us just 3 weeks ago. When I saw her first, the disease was so advanced that she was not able to walk. She had extensive bony metastases in thoracic and lumbar spine, as well as her pelvis. She was devastated and on wheelchair. She was barely breathing because she had severe pulmonary involvement with bilateral masses and nodules, too numerous to count. She had extensive liver disease that most of her liver was occupied by the cancer. Her bilirubin was 8. She was completely jaundiced. And she had malignant ascites as well as malignant pleural effusion. She was hypoxic, she was breathing shallow, and she was referred to hospice. When I saw her, I was very disappointed by the fact that conventional medicine in our age yet has not been able to offer any sort of effective therapy for patients with cancer, even in this early age at 41. It was very disappointing to see that a woman otherwise so healthy was devastated and was dying. So I first encouraged them to hold off the hospice and try our therapy, which was targeted at epigenetics as well as targeted at the genomics of her cancer. She was a BRCA positive breast cancer, so we formulated the therapies based on the information we had. She had a HER2 positive disease, so we targeted the HER2 with natural compounds, as she had already failed the standard treatments for HER2 target, which was Herceptin. Interestingly, she proved to be a very fast, quick responder to our therapy. In a matter of just 2 to 3 days, we repeated her labs, and after just 3 treatments, we noticed a substantial reduction on all her markers, including the serum HER2 level, which was a very big surprise. Her serum HER2 level was in 9,000 range, which I have never seen. The largest number that I have seen for serum HER2 is 200, and the normal is less than 20, and hers was over 9,000. I had never seen this. She responded so beautifully that after just a few days, she was able to walk. Her hypoxia completely went away. Her quality of life improved so much that she became a new person. They recorded her. She was walking into the clinic independently. She was not yellow anymore. The jaundice went away. At the time that I sent her to our consulting oncologist, he was amazed, and he certainly was impressed and consistently encouraged her to follow up with our therapy and continue our care. As we speak, it's about 3 weeks past. She's making progress every day. All markers are coming down, some up to 80% reduction. And we are very pleased to have her here as our panel of patients, and I would encourage you to listen to her testimonial. Thank you.
Okay, my name is Rebecca. This is my third week of treatment with Dr. Nezami. I had breast cancer 5 years ago, and I went through all the conventional treatment. I did everything: chemo, surgery. I did targeted therapy, Herceptin, and then 5 years later it came back. That was last year. So I also went for another treatment in Mexico when it came back, now metastasized, but the treatment didn't work. So about 2 weeks ago, somebody told us about Dr. Nezami, and we came here. By then, I had cancer in my liver. My liver was so swollen. I wasn't walking very well. I was in wheelchair. I don't eat very well. I've lost like half my body weight. I was really in a very bad shape. And when I came here, Dr. Nezami placed me on his IVs, on his custom IVs, and some oral what's it called again? Some oral chemo drugs, and I'm glad to say that now, just 2 weeks of treatment, I can walk again. I walked in here myself today on my third week. This is my first day of treatment in the third week, and I'm walking already. You could see my face. I wasn't like this when I came here. I've lost so much weight, but now I've added a little bit of weight. I can eat now, and I'm really very happy with the treatment so far, and I'm looking forward to completing the treatment here, and to great things that will happen. Yeah, my advice to people is that there are options out there. There are options. It's not only conventional treatment. There are other treatments that could be helpful. I thank God I was able to hear of this treatment, of this place, and come here. I've already gone to Mexico. Meanwhile, I stay in Bakersfield, just 2 hours away from Fresno. I didn't hear about this, so I'm really grateful to the person that told us about this place, and I pray that everybody will get the knowledge they need to get the help they need. Thank you.